Today we'll discuss the topic from neonatology. The topic is neonatal infections, which is also called perinatal infections. The neonatal or perinatal infections are specially caused by bacteria which are life-threatening. The neonatal infections are the major causes of death during neonatal period. The major congenital neonatal infections are either antenatal, which are acquired during antenatal period. They could be intranatal or they could be postnatal infections. They are about 20 to 50% causes of neonatal death. Neonates are more susceptible to infection. The reason behind that is they lack immunity. Immunoglobulins are also lacked, so therefore a small infection could lead to a life-threatening infection for them. Then the damage by any infective agents during the infective agent which enters into the baby could be life-threatening, and it may lead to a further damage during their growth period as well. It leaves a big effect on the baby. Then we'll discuss about the sources of infection. The various sources of infection could be either various conditions which caused during antenatal period, intranatal period or postnatal period. We'll discuss them one by one. If we talk about the antenatal, the sources during antenatal period, this is S. torch. S. torch are the infections which are seen in the mother. This S. torch is the acronym. S stands for syphilis, T stands for toxoplasmosis, O stands for others. Others is malaria, varicella, hepatitis B and HIV and a few other infections. R is rubella, C is cytomegalovirus, H is herpes simplex. These are the infections which are seen in the mother during antenatal period. The other cause during antenatal period is ascending infections. Ascending infections are contaminated liquor amnii. The fluid which is infected may lead to the infection in the neonate or in the fetus. Amnionitis. Amnionitis is infected amnion. Then prolonged rupture of membrane. If the membrane is ruptured for more than 12 hours, this leads to neonatal infections. Then comes intranatal period. During intranatal period, if there is aspiration of infected liquor, the infected liquor has been aspirated by the fetus. This leads to aspiration pneumonia. This is again an infection in the neonate. Then repeated pervaginal examination. During delivery, during intranatal period, the repeated pervaginal examination is done, which may be a cause of infection to the mother and infection to the birth canal. Then infected birth passage. If the birth passage would be infected, this may lead to infection of eyes, mouth of the baby. Then improper umbilical care. During delivery or at the time of delivery, when the umbilicus is cut and improper aseptic techniques are not maintained properly, this may lead to improper umbilical care and infection in the neonate. Then coming to the postnatal period. In postnatal period, the infected caregivers communicate the infection to the neonate. It means the caregiver, either the mother, father or any healthcare professional who is giving care is infected, may infect the neonate. Then cross infection. Cross infection from either the baby, other babies, the caregivers or hospital acquired cross infection could be a cause of neonatal infection. Then infected articles which are used for the care of baby, if they are infected, may lead to neonatal infection. Invasive procedures without aseptic technique. If invasive procedures are done without using aseptic technique, this may lead to neonatal infection. Then infected environment. If the environment in which the baby is being cared, the environment is infected, this may also lead to neonatal infection. So these are the antenatal, intranatal and postnatal factors which are leading to neonatal infections. Then we'll discuss about the factors responsible for perinatal infections. The main cause is low birth weight babies. If a baby is low birth weight, or this is a premature baby, or meconium aspiration is there, these would be will be on a high risk of getting neonatal infections. If there is contaminated intrauterine environment, this is also a factor which leads to neonatal infections. Infective birth passage or obstetrical complications. If during delivery there is any kind of complication, that may also lead to neonatal infections. Birth asphyxia and resuscitation. If a baby is born with any kind of birth abnormalities and baby is not able to establish birth, respiration at birth, then resuscitation is required. So during that period, the baby may also acquire infection, that is neonatal infections. Then congenital abnormalities. If the baby is having any kind of congenital abnormality, that could also be a factor responsible for neonatal infections. Then various neonatal procedures. If a baby is born either unhealthy or maybe having any kind of condition which may lead the baby to get into any kind of procedure. For example, endotracheal intubation, IV procedure is done, IV medications are being given to the baby, assisted ventilation is required, exchange blood transfusion is done. So any kind of these procedure is done for the baby, they may also make the baby to be at a risk of getting the neonatal infections. Then the gender of the baby. Males are at a high risk of getting these infections. Neonatal infections are more commonly seen in the males. Artificial feeding is also a cause of neonatal infections, because the babies who are given breastfeeding, they are at a lower risk of getting infection, and the babies who are getting feed from outside, that is artificial feeding, they get more infections. That may be due to infected feed, or maybe due to the articles which are being used for feeding. They may be not clean articles used during feeding, so that also leads to neonatal infections. And hypothermia also leads to neonatal infections. Then moving ahead, we'll discuss about the common infections which are seen in neonatal period. So classification of neonatal infections is, these could be either superficial or localized infection. The infections could be either superficial or localized, or they may be systemic infections. The infections which are seen as superficial infections are the infections of either eyes, skin or mouth, or umbilicus. And systemic infections are either septicemia, meningitis, pneumonia, necrotizing enterocolitis, DIC, disseminated intravascular coagulopathy, tetanus neonatorum, and so on. We'll discuss them one by one later. Then viral infections are also seen. Apart from bacterial infections which are more common and life-threatening, there are viral infections which are also seen in the baby, which lead to either death of the baby, may lead to some kind of congenital abnormality in the baby, and severe systemic infections are seen in the baby. Then how can we know, or how can we assess that the baby which is going to take birth would be having a high risk of infection? It means if a mother is having any of the three conditions, we'll be discussing them, any of the three conditions in the mother make us think that the baby will be having neonatal infection. These conditions are either maternal history of infection. It means if mother is having any kind of infection, then the baby would be having the infection in later life. If mother is having diabetes mellitus, COPD, chronic obstructive pulmonary disease in the mother, or if mother is having any kind of autoimmune disorder, IUGR baby, if the baby is having intrauterine growth retardation, that means the baby could be having some or other kind of infection, hepatosplenomegaly, jaundice, petechiae, and purpura. It means either the rashes or the blue purplish spots which are seen in the mother indicates that the mother is having some infection leading to giving birth to an infected baby. Meningoencephalitis. It means infection of meninges or brain, infection of brain and the related tissues in the baby. Then raised IgM in cord blood. It means if the cord blood sample is taken and that is assessed and that shows that increased level of IgM is there, it means the baby is at high risk of getting infection. Then moving ahead, we will discuss all the important infections in the baby one by one.